Why does urine cytology sometimes produce a false negative result? Imagine trying to find tiny clues in a sample of urine to see if cancer might be hiding in the bladder. Sometimes, even when cancer is present, the test doesn't catch it. That's because urine cytology depends on detecting abnormal or cancerous cells shed into the urine, but several factors can make this tricky. One big reason is that some bladder cancers, especially low-grade tumors, don't shed many or any abnormal cells into the urine. If the cancer isn't shedding cells actively, the sample might not have enough abnormal cells for the pathologist to see. This can lead to a false negative, meaning the test says no cancer when it actually exists. Sampling issues also play a role. Urine cytology usually examines cells from a urine sample that you void naturally. If the tumor isn't shedding cells at the moment, or if the sample doesn't include cells from the tumor site, abnormal cells can be missed. Sometimes, the sample might not contain enough cells overall, which makes it harder to find anything unusual. The type of tumor matters too. High-grade bladder cancers and carcinoma in situ tend to shed more abnormal cells, making them easier to detect. But low-grade tumors often look more like normal cells under the microscope, so they can be harder to identify. Cellular changes and interpretation challenges add another layer of complexity. Cancer cells can sometimes look similar to normal cells, especially if there's inflammation, infection, or recent treatments like radiation. These factors can obscure the abnormal cells, making diagnosis more difficult. Technical limitations are also important. If the urine sample doesn't have enough cells, or if the cells aren't preserved well during processing, the test's sensitivity drops. A poor specimen can easily lead to a false negative result. Biological variability means that some tumors are located in parts of the urinary tract that don't shed cells into the urine very often. For example, tumors in the upper urinary tract or certain areas of the bladder may not release enough cells into the urine to be detected. Because of all these factors, urine cytology is more reliable for high-grade cancers, which shed more abnormal cells. But for low-grade tumors, it's less sensitive. That's why a negative urine cytology doesn't completely rule out bladder cancer. Doctors often use additional tests like cystoscopy or imaging to get a full picture when suspicion remains high. In the context of bladder health and bladder cancer, urine cytology is a helpful non-invasive screening tool. However, it should always be interpreted alongside other diagnostic methods and clinical findings. This balanced approach helps catch cancers early and ensures patients get the right treatment. Remember, if you have concerns about bladder health, always consult a healthcare professional for personalized advice.